Have you ever wondered if your current self-touch habits might not be what your body truly needs, especially after 60? You're not alone. This is one of the most common questions I receive from older men, not just about the appropriateness of masturbation, but how to do it safely, respectfully, and in a way that genuinely supports your health rather than depleting it. I'm Dr. Isabella Ray Jane, and I've worked with thousands of men like you who aspire to remain connected to their bodies, feel confident in their sexuality, and age with dignity and strength. In today's video, we'll discuss a rarely explored, yet incredibly important topic: how to masturbate safely after 60, and the 3 major mistakes you absolutely must avoid. This discussion isn't about shame or performance. It's about safeguarding your circulation, prostate, hormones, and emotional well-being. So, if you've ever felt uncertain about what's normal or safe, you've come to the right place. Let's begin by understanding why this even matters. First, I want to reassure you of something crucial. Masturbation is not only normal, but genuinely healthy, particularly as we age. You see, as the years pass, many men begin to question whether their body still requires this kind of release. Or worse, they start to feel ashamed for still desiring it. But here's the truth. Regular, gentle self-stimulation is one of the simplest and most natural ways to support your male health after 60. It helps maintain blood circulation through the penis, nourishes the prostate, lowers stress hormones, and even improves sleep quality by calming the nervous system. However, and this is a critical point, the way your body responds to touch in your 60s or 70s is vastly different from your 20s or 30s. And there's no shame in that. It's not a failure, it's biology. As we age, our skin thins. The nerve endings that once fired instantly now require a bit more coaxing. And the blood vessels, especially in sensitive areas, can be more reactive and easily strained. That's why your approach to self-pleasure needs to evolve alongside your body. This isn't about applying more force or chasing intensity as you might once have. It's about tuning in, being mindful, being present, and listening to your body with care instead of treating it like a machine you need to fix. When you slow down and engage with yourself in a more thoughtful way, the experience becomes not only more pleasurable, but far more beneficial to your long-term health. Many men never hear this. No one teaches them that old patterns might no longer serve their body. Consequently, they continue doing what they've always done, ending up feeling frustrated, disconnected, or even a little bruised, both physically and emotionally. But the moment you realize your body now desires something different, something slower, kinder, more nourishing, that's when things begin to shift. That's when a new kind of pleasure becomes accessible, a pleasure that feels deeply connected and restorative. And that brings us to the first mistake many men make, often unknowingly. The first major mistake I frequently observe is rushing. While it might seem trivial, I urge you to pause and genuinely consider its impact, because the repercussions of rushing through self-pleasure at this age are greater than most men realize. Many older men treat masturbation as something to get over. It becomes a habit of speed, executed quickly with tension, often in silence and secrecy. But the truth is, this kind of rushed stimulation can quietly work against you, especially after 60. Here's what happens when you rush. Your nervous system remains in a state of alertness. Your blood vessels constrict instead of expanding. Your heart rate may rise, but not in a healthy, relaxed manner, more in a stressed, shallow breathing way. Your brain is still scanning for danger or interruption. Instead of receiving deep, nourishing blood flow to the penis, your body remains on edge. This prevents you from truly relaxing into sensation. As a result, you might feel unsatisfied, a little sore, or worse, find it increasingly difficult to even achieve arousal. When this becomes a recurring pattern, your body is trained to associate touch with tension, not with safety or calm. This means your arousal process, which should be smooth and enjoyable, becomes more mechanical, more rigid, and less responsive. The good news is that this can absolutely be changed, and it starts with a simple shift. Give yourself more time. Even a few extra minutes to slow down, take some deep breaths, and truly arrive in the moment can transform everything. You don't need to turn it into a spa ritual unless you wish to, but creating a small window where you're not pulled in multiple directions, not checking your phone, not anticipating interruptions, signals to your body that it's safe to let go. And when your body feels safe, the blood vessels soften, the nerves awaken, and the tissues become responsive again. And that, my friend, is when true satisfaction occurs. Not through pressure, not through speed, but through presence, through giving your body the gentle attention it has quietly been asking for all along. The second mistake, a common one often developed unconsciously over time, is using too much pressure. I cannot emphasize this enough. Many men, especially after 50 or 60, begin to grip more tightly or move more aggressively during self-stimulation. Sometimes it's habitual. Sometimes it's because the body feels a little less sensitive, and they're simply trying to feel something. But while the intention makes sense, the long-term result can cause more harm than good. Here's the thing, the penis isn't just skin and muscle. It's composed of delicate sponge-like blood vessels, sensitive nerve endings, and connective tissue designed to respond best to steady, gentle stimulation. When you repeatedly use a tight grip, it creates friction, compression, and strain on those tissues. Over time, this can lead to decreased sensitivity, where the nerves stop responding as they once did. Some men even develop what's informally termed death grip syndrome, where their body becomes conditioned to respond only to a very specific type of pressure and motion, usually their own hand. This significantly complicates enjoying intimacy with a partner or experiencing natural arousal. It can also lead to soreness, irritation, or tiny tears in the skin that you might not even notice initially. And if that area becomes inflamed or damaged, it can make future stimulation less comfortable, less enjoyable, and more stressful. This creates a cycle, and it's one you can absolutely break. The solution is all about gentleness. Try loosening your grip just a little. If it feels strange at first, that's okay. It might take a few days or weeks for your body to adapt, but it will. You can also use a natural, unscented lubricant to reduce friction and protect the skin. Focus more on how the experience feels, rather than trying to get it done. Breathe deeply. Relax your body. And view this not as a race or a task, but as a kind of therapeutic massage. Something intended to keep your tissue healthy, your circulation flowing, and your mind in sync with your body. The more you approach this time with patience and kindness, the more rewarding it becomes. You don't have to force pleasure. You just have to allow it under the right conditions. Now, the third mistake might surprise you because it has nothing to do with how you physically touch your body. It has everything to do with how you feel about it. Ignoring the emotional side of self-pleasure is something many older men have done for years without realizing the impact. Because, let's face it, most of us were never taught that our emotions and our hormones are interconnected, that our thoughts, memories, and stress levels all shape how we experience touch and arousal. For some men, this manifests as shame. Perhaps you were raised to believe that masturbation was wrong, dirty, or something to conceal. For others, it's about the changes that accompany age, how your body looks, how it responds, how long it takes. Slowly, these thoughts can become quiet sources of stress. You start wondering, am I normal? Is this okay? And instead of finding comfort in the experience, you feel tension, guilt, or even avoidance. But here's what's important to remember. Emotions that are suppressed don't simply disappear. They get stored in the body, in the muscles, in the breath, even in the way your blood flows. Over time, this emotional weight can lead to performance anxiety, disconnection from your body, or even depression. And for many men, that loss of connection transforms into a loss of desire, not because their body can't respond, but because their heart no longer feels safe in the experience. So, what can you do? First, begin with compassion. Remind yourself that this isn't about performance or proving anything. This is about connection, healing, and taking care of yourself in a deeply personal way. And if you find that difficult, that's perfectly okay too. Talk to someone. It could be a doctor, a therapist, or even a friend who understands what you're experiencing. There's nothing weak about needing support. In fact, it takes strength to open up about something this personal. You deserve to feel safe in your own skin. You deserve to enjoy your body, regardless of your age. And being honest about your emotions can be one of the most powerful steps toward that. It's not just about physical release, it's about self-respect. And it starts with letting go of shame and replacing it with understanding. Now that we've explored the 3 biggest mistakes, let's focus on something hopeful. How to create a healthy, safe, and satisfying self-care routine that includes masturbation. One that supports your health, honors your experience, and feels good in every sense of the word. Start with cleanliness. Ensure your hands are clean. If you use any tools, cloths, or towels, keep them clean too. Try to create a space that feels quiet and calm. Somewhere you can be alone, undistracted, and relaxed. Use a natural, fragrance-free lubricant to protect the skin and make things smoother. And always, always pay attention to what your body is telling you. If you feel pain, discomfort, tightness, or notice any changes like swelling, sores, or irritation, do not ignore it. These could be signs of something deeper, like inflammation, circulatory issues, or even a condition related to your prostate. And a doctor can help. But when done gently and mindfully, this practice can become a source of health. And if you're feeling unsure or like you're just beginning again after years of disconnect, that's perfectly okay. Many men rediscover their connection to their bodies in their 60s or 70s. It's not regression, it's evolution. It's learning what your body needs now, not what it used to need. And that's a beautiful thing. You're not broken, you're not past your prime, you're simply in a new phase of life, one that asks for more care, more intention, and more kindness. And when you respond to your body with that kind of care, it will respond back, often in powerful and beautiful ways. So tonight, or whenever you feel ready, give yourself the gift of attention, not performance, not pressure, just presence. You deserve that. And if you found this helpful, please consider subscribing because your body still matters, your pleasure still matters, and your confidence is worth protecting. Until next time, stay strong, stay curious, and take good care of.